Good day, my name is Jasmine Lizette Frusa, and I am a third-year nursing student from Pamantasan ng Lungsod ng Maynila. And for this video, I will be showing you how to manage clients using electronic medical records. So let's get started.
It's cold outside.
Let's begin with the interview. Interviews are used to gather personal information from our client that we will use for the provision of our overall patient care. Magandang umaga po, ma'am. Ako po si Jasmine, ang student nurse ninyo ngayong araw. Ma'am, ano po yung buong pangalan ninyo?
Maria Alexis A. Segovia.
Kailan po kayo pinanganak?
September 11, 1999.
Ano po yung buong address ninyo, ma'am?
2916, C. Balanga, Tondo, Manila.
Ma'am, ano po yung contact number nyo?
0915-371-8950.
Kasama ninyo kanina. Ano po yung buong pangalan niya?
Catherine Segovia.
Ma'am, ano po yung nararamdaman ninyong problema sa katawan ninyo ngayon?
4 na beses na po ako tumatae ngayong araw. Kahapon po ay 3 beses. At madalas din po akong sumusuka o parang nasusuka.
Sige po, salamat po ma'am, babalikan po namin kayo. Now that we have gathered all the informations that we need, we are going to input all of this in the electronic medical records. So I have made a workflow following the step-by-step procedure in using electronic medical records. So the first one will be log in to the website. Second is register a patient. Third will be admit the patient. Then fourth is to capture the vital signs. 5 is to start a visit. Then next, ask for allergies. Then review the records. First thing will be, we will type the link for the Open MRS. Then we will click the Launch MRS Demo. Type in our username and password, admin for the username and admin123 for the password. Then select a location. In here, I chose inpatient ward. Then we will be welcomed by this lobby. In the lobby, we will choose register a patient. Wait for it to load. Then type in the name that we gathered in the interview. Maria Alexis Abisamis Segovia. For gender, female. Birth date will be 11 September 1999. For the address, 2916 Balanga Street, Tondo, Manila. Country, Philippines. Postal code will be 1014. Phone number. Relative will be parent. Name, Cathy Abesamis. Then we will see the summary of our demographics. Let's just click confirm if all the information that we input is correct to save our data. This will lead you to your patient's dashboard. For us to place our patient in the inpatient ward, we have to first start the visit. So click start visit. Click confirm. Now we could admit our patient. In admitting our patient, we have the date, the person who admit, and the place on where to admit. Then click save. After the interview, we must capture the vital sign of our patient. Capturing the temperature, blood pressure, respiratory rate, and heart rate determines the baseline data for the provision of patient care. For the visit note, we could select the patient's diagnosis. Our patient's diagnosis is bacterial diarrhea. Under the clinical note, there we could type in the whole nursing care plan. For the assessment in subjective, we would write in the shift complaint of our patient, as verbalized by the patient. For the objective, we type in our observations, so loose bowel movement, with yellowish watery stool, minimum of thrice a day, increased bowel sounds or peristalsis, nausea and vomiting, and abdominal cramping. Next is for the diagnosis. So the medical diagnosis already placed on the primary diagnosis, which is the bacterial diarrhea, and our nursing diagnosis would be diarrhea related to infectious processes. Here, in the inference or scientific inference, we would write gastroenteritis is an inflammation of stomach and So for the planning, we would write in the short term and the long term. For short term, after 2 to 3 hours of nursing intervention, the patients will gain knowledge about diarrhea. For the expected outcome of the short term intervention, the person will verbalize understanding of causative factor, verbalize the rationale for the treatment regimen, and for the long-term planning, we have after 1 to 2 days of nursing intervention, the client will be free from diarrhea. Expected outcome for this planning is to re-establish and maintain normal bowel movement, reduction in frequency of stools. For the nursing intervention, we will write in the following dependent and independent nursing interventions with their own rationale. After that, we will proceed to evaluation. After completing the clinical notes, we will click Save. We could also attach files in the attachment. Here we could drop the file. Now we could also search our client from the patient record and click Appointments. And we could also book the date that we wanted. On our patient dashboard, we could also add the condition of our client and their own allergy. Add new allergy. We have allergy from drug, allergy from food, and others. We could select the reactions of their own allergy and the severity. But for our patient, she has none, so we could click No Known Allergy. In the patient dashboard, we also have health trend summary, weight graph, and latest observations. Now, if we think we are already done with the visit, we could end the visit, and we should not forget to log out our account for confidentiality purposes. For giving health education, we have the 6-step rubric, which says identify the question, locate resources, analyze for validity, analyze for reliability, determine the answer, and reflect on answer. So our question is, how could the patient be knowledgeable about her own condition? I chose to search for NANDA-based information about diarrhea, which is a professional organization of nurses interested in standardized nursing technology. Then, Nurses Labs showed up. For the second step, to locate the sources. In Nurses Labs, we could locate the author of the article and a brief summary about them would appear. By viewing the author and the sources, we could analyze the validity of the information. We could also see the date when the article was published. They also cite sources on where the information came from originally. And through proper skimming and scanning of information in the internet, we could identify our problems and give the client a proper health education. By reviewing every step that we did, we could reflect on the whole nursing process. That will be all for this video. Thank you for watching.